early cancer signs you shouldn't ignore. It could save your life. Hello everyone, welcome back to the channel Health is Wealth. Today's video is on a life-saving topic, -12 early signs of cancer that you should never ignore. Spotting these signs early can make a world of difference in treatment outcomes. Remember, cancer doesn't always make itself obvious, so it's crucial to stay informed. Watch until the end because knowing these signs could literally save your life. Cancer can develop silently with symptoms that are easy to overlook or attribute to less serious issues. This is why being aware of the potential warning signs is so important. In this video, we'll break down these early signs and help you understand why they matter. Let's jump right in. Now I request Dr. Answer to explain the points one by one.
1. Unexplained weight loss. While some people may view abrupt weight loss as a godsend, particularly if you're not attempting to reduce weight, it could potentially be an indication of more significant problems. More than 10 pounds lost without altering one's diet or level of exercise raises concerns. This can be brought on by a variety of malignancies, including those that affect the stomach, lungs, and pancreas. Because cancerous cells consume a lot of energy, the body may burn calories more quickly while fighting the illness. Talk to your doctor and rule out any underlying health issues if you find this happening to you. 2. Fatigue that doesn't go away. Although everyone has occasional fatigue, cancer-related fatigue is unique. This is an intense form of fatigue that does not subside with sleep. It's the kind of exhaustion that can make seemingly unachievable tasks seem insurmountable. There are known causes of this kind of lethargy, including stomach, colon, and leukemia malignancies. For instance, leukemia causes the body to produce excessive amounts of aberrant white blood cells, overwhelming it and impairing its capacity to carry oxygen and fight off infections. This wears the body out. See a doctor to rule out any possible problems if you're always exhausted for no apparent cause. 3. Persistent cough or hoarseness. A persistent cough that won't go away can be concerning, particularly if it persists for longer than 3 weeks. A chronic cough may indicate lung cancer, even though the majority of coughs are caused by allergies or illnesses. It is really worrying if your cough produces blood or if it is accompanied by dyspnea. Likewise, voice abnormalities or hoarseness that doesn't go away could be signs of throat or vocal cord cancer. It's time to get checked out if regular therapies don't alleviate these symptoms. 4. Changes in bowel or bladder habits. Your frequency of restroom visits may change subtly but seriously. Constipation, persistent diarrhea, or the sensation that your intestines are never quite empty can all be indicators of rectal or colon cancer. Another major warning sign that should never be disregarded is blood in your stool, which is frequently misdiagnosed as hemorrhoids. Similar to this, changes in the bladder, such as the desire to urinate more often, pain when urinating, or blood in the urine, can be signs of tumors like prostate or bladder cancer. It's imperative to see a doctor if these symptoms worsen despite appearing to be minor. 5. Or bruising. It's important to pay attention to any odd bleeding or bruises that may be caused by cancers. For example, blood in the stool can signify colon cancer, whereas coughing up blood can indicate lung cancer. Unusual vaginal bleeding may indicate cervical or uterine cancer early on, especially if it occurs outside of your regular monthly cycle. People who have leukemia occasionally discover that their blood clotting ability is compromised, making them more prone to bruises. Any type of unexplained bleeding should always be looked at by a medical practitioner. 6. Lumps or swelling. The breast, neck, armpits, or groin is one of the most identifiable warning symptoms of cancer. Even though not all lumps are cancerous, you should take urgent action if you find a new lump that doesn't go away or keeps growing. Lymphoma, testicular cancer, and breast cancer are frequently linked to lumps or swelling in these regions. For instance, lymphoma frequently manifests as enlarged lymph nodes, whereas breast cancer might cause painless lumps in the breast tissue. As soon as you see any strange lumps, make an appointment to get them examined. 7. Changes in skin or moles. Skin alterations are a big warning signal for melanoma, a type of skin cancer. This is especially true for moles that change in size, shape, or color. See a dermatologist immediately if you observe a mole growing larger, darker, or forming uneven boundaries. Furthermore, keep an eye out for areas of your skin that bleed, become scaly, or refuse to heal. If detected early enough, skin cancer can be effectively treated, so don't disregard any changes you notice in your skin, even if they initially appear to be insignificant. 8. Difficulty swallowing. Malignancies of the esophagus or throat can occasionally be connected to difficulty swallowing or a feeling that food is becoming lodged in the chest or neck. Many times this symptom is easily ignored since individuals think it's just a passing problem, similar to acid reflux. Nonetheless, it's advisable to visit a doctor if it continues or gets worse. This is a common symptom of esophageal cancer, and treatment outcomes are higher the earlier the cancer is detected. 9. Chronic heartburn or indigestion. Heartburn is a common occurrence, but if it persists or becomes severe and is not relieved by medicine or lifestyle modifications, it may be an indication of serious health issues. Chronic heartburn or dyspepsia can be a symptom of stomach or esophageal cancers, which are frequently ignored until the cancer has advanced. Schedule an appointment in order to rule out a more serious condition if over-the-counter remedies aren't working. 10. Unexplained pain. Depending on where it is located, cancer might produce mysterious pain. For instance, recurrent headaches that don't go away with standard care may indicate a brain tumor. Back pain that doesn't go away, particularly in women, may occasionally be related to colon or ovarian cancer. Cancer pain can be throbbing, dull, or acute. If your pain persists for an extended period of time without a clear explanation, you should consult a doctor. 11. Sores that don't heal. If sores, especially those on the skin or in the mouth, don't go away in a fair amount of time, they may be indicators of oral or skin cancer. Individuals who smoke or use tobacco products have an increased risk of mouth cancer. A medical professional should be consulted for any sore that lasts longer than 2 weeks, especially if it hurts or bleeds. 12. Changes in lymph nodes. The immune system contains tiny bean-shaped glands called lymph nodes. Although swollen lymph nodes are frequently indicative of an infection, they may also be indicative of malignancy such as lymphoma or leukemia if the swelling lasts longer than a few weeks or if the nodes are hard, locked in place, or painless. A trip to the doctor is necessary if you observe any changes in your lymph nodes, especially if the swelling doesn't go down. Remember, just because you have one or more of these symptoms doesn't mean you have cancer. These indicators, though, should never be disregarded. It's usually best to err on the side of caution when it comes to cancer screening, as early identification greatly increases the odds of successful treatment. Do not hesitate to contact a healthcare provider if you are experiencing any of these symptoms. If this video was useful to you, please subscribe, like, and share. Let's get the word out so that more people are aware of these warning indicators. Your knowledge might prevent a fatality. I hope you stay well and see you in the upcoming video. Thank you for watching and take care of your health.